Canadians can now call an emergency hotline specifically for critical medical advice on poisonings. Health Canada is launching the new toll-free number 1844 Poison X as part of National Poison Prevention Week, which runs from March 19th to the 25th of 2023. The agency says that many Canadians don't know the phone number of their local poison center or what services are available to them. It says more than 1,500 people lose their lives each year to unintentional poisonings from medications, cleaners, and other household items. The country's network of poison centers handle almost two-thirds of cases remotely, without the requirement of entering a healthcare facility. Well, joining us now to give us his advice on how to prevent unintentional poisonings for National Poison Prevention Week is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Right. Happy to join you.
It's quite surprising to hear that over 1,500 people in Canada die from unintentional poisonings each year. Why do you think that's such an issue?
Right. It's quite surprising indeed. So 1,500 people lose their lives, nearly 8,000 hospitalizations due to unintentional poisoning from medications, cleaners, and many other products there. So what we are seeing is that these poison centers that you mentioned, they managed close to about 215,000 cases in 2020, and more than a third of those cases all involved a child less than 5 years of age. So very important to have these poison control centers in place.
Very interesting that children were linked to most of these cases. Now, what products were found to be linked to the most to these unintentional poisonings in Canada?
Right. So medications are the leading cause of poisoning in Canada. Over-the-counter medications, prescription drugs, illicit drugs, alcohol, cannabis, depending on the quantity taken. By far, the most common poisoning is analgesics or pain relief medications. This is typically followed by sedatives or antidepressants. If you look at the non-pharmaceutical causes, top three would really be household cleaners like bleach or laundry detergent, alcohol, and personal care products like nail polish, for instance.
And in terms of symptoms, especially for painkillers, what sort of symptoms do people present in terms of unintentional poisonings?
So I think what we see there, especially with unintentional poisonings, in painkillers, you'll see the abdominal pains, the irritability, general weakness, and loss of appetite. As we get more severe, you see things like jaundice, diarrhea, vomiting, and even convulsions and coma.
Concerning symptoms there. Now, let's look into some of these other potentially poisonous items, starting with household cleaners, Dr. Rout. Now, other than the obvious, don't drink them, how else do they pose a poisonous risk to Canadians?
Right. So we know that these cleaners do have very specific chemicals like ammonia, ethylene glycol, sodium hypochlorite, or trisodium phosphate. Now, depending on all of these ingredients, these cleaners can irritate the skin, eyes, nose, and throat, and they can be highly poisonous, as you mentioned, if swallowed. The big issue here is oftentimes people mix cleaning agents, and when you mix them, you can sometimes get even stronger, more poisonous gases created, like chloramine gases if you mix bleach with cleaner with ammonia, which can be extremely dangerous as well.
Very important information, Dr. Rout. Now, you mentioned cannabis earlier on. So while cannabis is legal in Canada, there has been concerns around edibles and children. Can you tell us a little bit more about the concerns around cannabis and poisonings?
Right. So it can be very unpleasant and quite potentially dangerous if cannabis is consumed in large amounts, especially if children find it as well. What we see in those cases are chest pains, a very rapid heartbeat, nausea, vomiting. You can also have psychotic episodes and severe respiratory issues, as well as anxiety and panic attacks.
All right, Dr. We've got about a minute left here, so I really want to get into what steps people should take in the event of an accidental poisoning. What should they do?
Right. So I think we've come a long way here to unifying a lot of the poison centers with one number. So it's 1844 Poison X. And in most provinces, you'd be able to call that number and get 24 access to medical professionals, which can give advice and as well as tell you to go to the hospital should you require it.
All right, Dr. Out. And in terms of prevention and preparing for something like this, what is your advice for families in terms of protecting themselves and especially their children from preventable poisonings?
Right. So a lot of these poisonings happen because we have these items very close by. So the key messages here is to keep those medications away from your children, keep the cleaners away from the children, and as best as possible, don't mix household cleaners and don't mix medications, and we're all going to be fine.
Another very informative interview. Dr. Rao, thank you again for your time today.
Thanks so much for having me.
See you next week.